Question. Do you have a mental health diagnosis? I mean, like, have you been diagnosed with bipolar, anxiety, depression, schizophrenia, BP, multiple personalities? What I want to know, if you ever been diagnosed with a mental health diagnosis, behavioral health, or whatever, and you over the age of 21, let's say 21, how do you introduce that conversation to somebody you start dating? How do you explain to them that you have had some challenges before and, you know, unfortunately you had some crisis in your life and you've been diagnosed with these different diagnoses and, you actively take care of yourself, whether it's medication or however recovery pathway that you choose to take holistically, and you feel you're doing well. We all know what those type of setbacks sometimes you get, but those type of those diagnoses, you can have some setbacks. But I really want to know, have an open conversation. A lot of people are out here dating and lying. You need to be honest with yourself. And some of your mental health issues that you're dealing with, or you're not even recognizing, comes from some of the traumas you done had and how you dealing with things right now. And it's so important when you move into a space of others that you want to share, that you be open and honest with yourself and with them. So, back to what I was saying, I want to know, I got a good answer, but I want to know what your answers are. This for the therapist, anybody who's out there who tap into, the psychotherapist, the licensed professional therapist, counselor, licensed clinical social workers or whatever. If any type of therapy work that you do or whatever, sex therapists and all those different type of family support, any of you, when it comes down to your clients, are telling them how to be honest with when it comes down to dating, with the diagnosis. And as a peer support, where I fall in at, as a peer, I want to open that conversation.